Sarah Martinez walked through the hospital corridors for what she believed would be the last time as an employee. Her white nursing shoes squeaked against the polished floor, echoing the heaviness in her heart. After 15 years of dedicated service at Mary's General Hospital, today marked the end of her career due to budget cuts that had hit the medical staff hard. The morning had started like any other. Sarah arrived at 6 in the morning, grabbed her coffee from the nurse's station, and began checking on her patients in the cardiac wing. She had always been known for her gentle touch and caring nature. Patients often requested her specifically, and families trusted her completely with their loved ones. But none of that seemed to matter when the administration needed to reduce costs. Dr. Williams, the chief of staff, had called her into his office 3 weeks ago. The conversation still replayed in her mind as she made her rounds. He had explained that despite her excellent record and patient reviews, the hospital was facing financial difficulties. Several experienced nurses would have to be let go, and unfortunately, Sarah was among them. The irony wasn't lost on her that they were keeping less experienced staff who worked for lower wages. As she entered room 302, Mrs., an elderly woman recovering from heart surgery, smiled weakly at her. Sarah had been caring for Mrs. for the past week, and they had developed a special bond. The patient's family had specifically thanked Sarah multiple times for her compassionate care during their mother's difficult recovery. "Good morning, Mrs.," Sarah said softly, checking the monitors and adjusting the patient's pillows. "How are you feeling today?" The elderly woman reached for Sarah's hand with trembling fingers. "Much better when you're here, dear. You have magic hands and a kind heart. The other nurses are nice, but you make me feel safe." Sarah felt a lump forming in her throat. She had decided not to tell her patients about her situation. There was no point in worrying them during their recovery. Instead, she smiled and continued with her routine care, making sure Mrs. was comfortable before moving to the next room. The pediatric ward was her next stop. Here, she found little Tommy, a 7-year-old boy who had been in the hospital for 2 weeks following a severe asthma attack. His parents worked multiple jobs and couldn't always be there, so Sarah had become like a surrogate aunt to him. She would often stay after her shift to read him stories or help him with simple games. "Miss Sarah," Tommy's face lit up when he saw her. "Are you going to read me another story today? I finished the coloring book you brought me yesterday." Sarah sat on the edge of his bed, fighting back tears. "Of course, sweetie. What story would you like to hear?" As she read to Tommy about brave knights and magical adventures, Sarah couldn't help but think about all the children she wouldn't be able to help in the future. Nursing wasn't just a job for her, it was her calling. She had gotten into this profession after her younger brother had spent months in the hospital as a child, and she had seen firsthand how much difference a caring nurse could make. The afternoon brought more familiar faces and bittersweet moments. In the emergency room, she assisted Doctor with several cases, including a construction worker who had injured his back and a young mother who had brought her feverish toddler in for evaluation. Sarah's experience showed in every action. She knew exactly what supplies the doctors needed before they asked, could calm anxious family members with just the right words, and had an intuitive sense about which cases needed immediate attention. Nurse Jennifer, one of her younger colleagues, pulled her aside during a brief break. "Sarah, I heard about what happened. This is so unfair. You're the best nurse we have here. Patients ask for you by name, and the doctors always want you on their teams for difficult cases." "I know," Sarah replied, trying to stay strong. "But business is business, I suppose. They need to cut costs somewhere, and experienced nurses cost more than new graduates." "But you can't replace experience overnight," Jennifer protested. "Just last month, you caught that medication error that could have been fatal. Remember the patient in ICU whose condition was deteriorating, and you noticed the subtle signs before anyone else? You saved that man's life." Sarah remembered that night well. Mr. had been stable after his surgery, but something hadn't felt right to her. His vital signs were within normal ranges, but his color was slightly off, and his breathing seemed different. She had insisted on additional tests despite resistance from the resident on duty. Those tests revealed internal bleeding that could have killed him if not caught in time. As her shift neared its end, Sarah found herself in the break room, packing up her personal belongings. Her locker contained 15 years' worth of accumulated items, thank you cards from patients and families, photos from hospital events, her favorite stethoscope that her grandmother had given her when she graduated nursing school, and small mementos that reminded her of the lives she had touched. The thank you cards were particularly difficult to look at. There were dozens of them, written by grateful patients and family members over the years. One was from the parents of a premature baby she had helped care for in the NICU. The baby, now a healthy teenager, still sent her birthday cards. Another was from an elderly man who had been alone during his final days, and Sarah had held his hand and talked with him so he wouldn't die afraid and lonely. Doctor, the hospital's head of emergency medicine, walked into the break room as Sarah was closing her locker. "Sarah, I just heard the news. This is absolutely ridiculous. Do you know that your patient satisfaction scores are consistently the highest in the hospital, and your clinical skills are unmatched? I've been practicing medicine for 25 years, and I've rarely worked with a nurse as skilled and dedicated as you." "Thank you, doctor," Sarah said quietly. "That means a lot coming from you." "Have you thought about what you're going to do next?" he asked. "With your experience and reputation, any hospital would be lucky to have you." Sarah shook her head. "Honestly, I'm not sure. The job market is tough right now for experienced nurses. Everywhere I've looked, they want to hire new graduates at lower salaries. I might have to consider changing careers entirely, maybe go back to school for something else." The thought of leaving nursing altogether made her feel physically ill. This profession had been her identity for so long. She couldn't imagine doing anything else. But at 43, starting over in a new field seemed daunting and scary. As 8 o'clock approached, marking the end of her shift and her career at Mary's, Sarah made one final round to check on her patients. Mrs. was sleeping peacefully, her monitors showing steady, healthy rhythms. Tommy was also asleep, clutching the small stuffed elephant she had brought him from the hospital gift shop with her own money. In the emergency room, she helped transfer care of the remaining patients to the night shift nurses. She gave detailed reports about each patient's condition, medications, and specific needs. Even though this was her last day, she wanted to make sure everyone received the best possible care. The night shift supervisor, Maria, had been a friend of Sarah's for years. She walked with Sarah toward the exit, both of them struggling with the emotion of the moment. "This place won't be the same without you," Maria said, her voice breaking slightly. "You've been the heart of this hospital for so many years. The way you care for patients, the way you mentor new nurses, the way you stay calm during emergencies, it's irreplaceable." "The hospital will be fine," Sarah replied, though she didn't entirely believe it herself. "There are many good nurses here who will take excellent care of everyone." As they reached the main exit, several staff members had gathered to say goodbye. There were nurses from various departments, a few doctors, some of the cleaning staff who had worked with Sarah over the years, and even a couple of security guards who had come to respect her dedication. Someone had brought a cake, and there were hugs and tears as Sarah said her final farewells. The parking lot was quiet as Sarah walked to her car. The evening air was cool, and she could see the lights of the hospital behind her, knowing that inside, the work of healing continued without her. She sat in her car for a few minutes, looking back at the building where she had spent so much of her adult life. Her phone rang, interrupting her thoughts. It was her sister calling to check on how her last day had gone. "How are you holding up?" Lisa asked gently. "It's harder than I thought it would be," Sarah admitted. "I keep thinking about all the patients I won't be able to help, all the families I won't be able to support during their difficult times. This job was more than just work for me, you know." "I know," Lisa replied. "But maybe this is an opportunity for something new and different. You've always been so focused on nursing that you've never explored other possibilities." As Sarah drove home through the quiet streets, she tried to imagine what her future might look like. Could she really be happy doing something other than nursing? The skills she had developed over 15 years, quick thinking under pressure, empathy, attention to detail, the ability to communicate with people during their most vulnerable moments. Surely those skills could transfer to other fields. But deep in her heart, she knew that nursing was more than just a job for her. It was her passion, her purpose, her way of making a difference in the world. The thought of hanging up her stethoscope forever felt like losing a part of herself. Little did Sarah know that her story was far from over, and that the next day would bring events that would change not only her life, but also prove just how valuable her skills and experience truly were. Sarah woke up the next morning feeling lost and uncertain. For the first time in 15 years, she didn't have anywhere to be at 6 in the morning. The silence in her apartment felt strange after so many years of rushing to get ready for work. She made herself a cup of coffee and sat by her window, watching the city wake up around her. Her phone had several missed calls and text messages from colleagues checking on her. The news of her termination had spread quickly through the hospital, and many people were expressing their disbelief and anger about the decision. Dr. Williams had apparently received numerous complaints from staff members about letting such an experienced and skilled nurse go. Around 10 in the morning, Sarah decided to take a walk through the park near her apartment. She needed fresh air and time to think about her next steps. The park was peaceful, with joggers running along the paths and families enjoying the playground. She found a bench under a large oak tree and sat down, trying to organize her thoughts about the future. As she sat there, her phone rang. The caller ID showed Mary's hospital. Her heart skipped a beat, wondering if perhaps they had reconsidered their decision. She answered quickly. "Sarah, this is Dr. Williams," came the familiar voice of the chief of staff. "I know this is awkward given yesterday's circumstances, but I have an unusual situation. We've had 3 nurses call in sick today, and we're extremely short-staffed in the emergency room. I know it's a lot to ask, but would you be willing to come in for a temporary shift? We'd pay you at the consultant rate." Sarah felt a mix of emotions. Part of her wanted to say no out of principle. They had fired her yesterday and now needed her help today. But another part of her, the part that had dedicated her life to caring for others, couldn't ignore the fact that patients might suffer if the emergency room was understaffed. "What time do you need me there?" she asked finally. "As soon as possible," Dr. Williams replied, relief evident in his voice. "And Sarah, I want you to know that several board members have been asking questions about our staffing decisions. Your termination may not be as final as we thought." Sarah felt a spark of hope but tried not to get too excited. She had learned not to count on promises from hospital administration. "I'll be there in 30 minutes, she said. When she arrived at the hospital, the emergency room was indeed chaotic. Ambulances were arriving regularly, and the waiting room was packed with patients. The nursing staff looked overwhelmed and stressed. Sarah quickly changed into scrubs and jumped into action, her muscle memory taking over as she fell into the familiar rhythm of emergency nursing. The first case she handled was a motorcycle accident victim who had been rushed in with multiple injuries. The young man, probably in his 20s, was conscious, but in severe pain. Sarah worked alongside Dr. Martinez, helping to stabilize the patient while preparing him for emergency surgery. Her experience showed immediately. She anticipated what the doctor needed, knew exactly how to position the patient for maximum comfort while allowing for treatment, and kept the young man calm by talking to him in a reassuring voice. "What's your name?" she asked the patient as they worked on him. "Jake," he replied through gritted teeth. "Is it bad? Am I going to be okay?" "Hi, Jake, I'm Sarah, and I'm going to take very good care of you," she said, holding his hand while the medical team worked. "Dr. Martinez is an excellent surgeon, and we're going to get you fixed up. I need you to stay calm and breathe slowly for me. Can you tell me about your motorcycle? What kind is it?" By keeping Jake talking about something he cared about, Sarah helped distract him from his pain and fear while the team prepared him for surgery. This was exactly the kind of skill that couldn't be taught in school. It came from years of experience working with patients during their most frightening moments. The next several hours flew by in a blur of activity. Sarah handled case after case: a child with a broken arm who was terrified of the hospital, an elderly woman having chest pains, a construction worker who had been hit by falling debris, and a young mother whose baby was having difficulty breathing. Each case showcased different aspects of her expertise. With the frightened child, she knew exactly how to make the experience less scary, turning the process into a game and explaining everything in terms a 7-year-old could understand. For the elderly woman with chest pains, Sarah's experience helped her recognize subtle signs that suggested the patient was having a heart attack, prompting immediate intervention that likely saved the woman's life. The baby with breathing difficulties was perhaps the most challenging case. The infant was only 6 months old, and the parents were panicking. Sarah's pediatric experience proved invaluable as she helped the doctors determine that the baby was having an allergic reaction to a new food the parents had introduced. Her calm demeanor helped reassure the terrified parents while the medical team worked to stabilize their child. Doctor, who was working the emergency room that day, pulled Sarah aside during a brief lull in activity. "I don't know how we've been managing without you," he said. "In just 4 hours, you've handled more cases efficiently than some nurses handle in a full shift. The difference in patient care is remarkable." "This is what I love doing," Sarah replied simply. taking care of people when they need help the most. As the afternoon progressed, word spread throughout the hospital that Sarah was back, even if just temporarily. Patients who had specifically requested her in the past were asking if they could see her. Mrs. from the cardiac ward had sent a message asking when Sarah would be back permanently. Little Tommy in pediatrics had drawn her a picture that one of the nurses brought down to the emergency room. Around 4 o'clock, things began to calm down slightly. Sarah was helping to restock supplies when she heard a commotion outside. Through the emergency room windows, she could see 2 helicopters landing on the hospital's helipad. This wasn't entirely unusual. The hospital occasionally received critical patients via helicopter, but having 2 arrive simultaneously was rare. The emergency room doors burst open, and several paramedics rushed in, followed by what appeared to be military personnel. Sarah looked closer and realized these weren't regular medical helicopters. They appeared to be government or military aircraft. Doctor, the head of emergency medicine, came running from his office looking confused and concerned. "What's going on?" he asked the lead paramedic. "We have a situation," the paramedic replied urgently. "There's been a major accident at the chemical plant outside the city, multiple casualties with potential toxic exposure. We need your best people immediately. We're setting up a field hospital at the site, but we need experienced nurses who can handle mass casualty situations and toxic exposure protocols." Doctor immediately began calling out assignments to the available staff. "Williams, you're with me. We need nurses who—" "Excuse me," interrupted one of the military personnel, a woman wearing the uniform of a colonel. "We've specifically requested certain medical personnel based on their experience and expertise. We have a list of names." She pulled out a tablet and began reading. "We need Dr. Williams and Nurse Sarah Martinez." Sarah's heart stopped. How did they know her name? Why would government officials specifically request her for this emergency? Doctor looked confused. "Sarah was let go yesterday due to budget cuts. She's only here today temporarily because we were short-staffed." The colonel's expression grew serious. "According to our records, Nurse Martinez has extensive experience in emergency medicine, toxic exposure protocols, and mass casualty situations. She was specifically recommended by the state emergency response team based on her handling of the industrial accident 3 years ago." Sarah remembered that incident clearly. A factory explosion had sent dozens of workers to the hospital with various injuries and chemical burns. She had worked for nearly 24 hours straight, helping to coordinate care for the victims and implementing protocols for dealing with toxic exposures. Apparently, someone had been paying attention to her work that day. "I don't understand," Sarah said, stepping forward. "How do you even know who I am?" The colonel turned to her directly. "Nurse Martinez, during that factory accident 3 years ago, your quick thinking and expertise saved 17 lives. You recognized that the patients weren't just suffering from burns and injuries, but from a specific type of chemical poisoning. Your recommendations for treatment protocols prevented what could have been a much larger tragedy. Your name has been on our emergency response list ever since." Sarah felt a chill run down her spine. She had no idea that her work that day had been noticed by anyone outside the hospital, let alone by government emergency response teams. Doctor spoke up. "Sarah, this is incredible. I had no idea you were on any kind of emergency response list." The colonel continued. "We have 18 people at the chemical plant site with various levels of toxic exposure. 3 are in critical condition. We need medical personnel who understand both emergency trauma care and chemical exposure protocols. Nurse Martinez, your expertise could be the difference between life and death for these victims." Sarah looked around the emergency room at her colleagues, then back at the colonel. The weight of the situation hit her immediately. People were in danger, and apparently her specific skills and experience were needed to help save them. "When do we leave?" she asked without hesitation. "Right now," the colonel replied. "We have protective gear and equipment on the helicopters. The field hospital is already being set up, but we need you there immediately." As Sarah prepared to leave with the emergency response team, Dr. Williams appeared at her side. "Sarah, when this is over, we need to talk. I think the board needs to reconsider some recent decisions." But Sarah wasn't thinking about her job status anymore. Her mind was focused entirely on the people who needed her help. She grabbed her personal medical bag, said a quick goodbye to her colleagues, and headed toward the helicopters, ready to face whatever challenges awaited her at the accident site. The helicopter ride to the chemical plant was unlike anything Sarah had ever experienced. Through the aircraft's windows, she could see smoke rising from the industrial complex below. The colonel, who had introduced herself as Colonel Hayes, briefed Sarah and the other medical personnel during the flight. The explosion occurred at approximately 2:30 this afternoon in the main processing facility, Colonel Hayes explained over the helicopter's noise. 18 workers were exposed to a combination of industrial chemicals, including sulfuric acid vapors and chlorine gas. We've evacuated everyone from the immediate area, but 3 workers are in critical condition, and the others are experiencing various symptoms of chemical exposure. Sarah listened carefully, her mind already working through the medical protocols she had learned over the years. Chemical exposure cases were complex because symptoms could develop slowly and different chemicals required different treatment approaches. The combination of sulfuric acid and chlorine gas was particularly dangerous because it could cause severe respiratory damage and chemical burns. "What kind of field hospital setup do we have?" Doctor asked. "Full mobile emergency unit," the colonel replied. "Oxygen supplies, decontamination stations, basic surgical equipment, and communication links to poison control centers. But we need experienced personnel who know how to prioritize treatment and manage multiple critical patients simultaneously." As they approached the landing site, Sarah could see the scope of the operation. Multiple emergency vehicles surrounded a large white tent that had been set up as the field hospital. Teams were still working in the affected areas, and she could see several ambulances waiting nearby. The moment the helicopter touched down, Sarah and the team were rushed to the field hospital. The scene inside was organized chaos. Medical equipment had been quickly set up, and the 18 affected workers were arranged on stretchers in order of severity. Sarah immediately assessed the situation, her trained eye quickly categorizing the patients. The 3 critical patients were easy to identify. They were having severe difficulty breathing and showed signs of chemical burns on their exposed skin. 5 others were conscious, but experiencing respiratory distress and nausea. The remaining 10 appeared to have milder exposure symptoms, but still needed careful monitoring. Doctor began directing the overall medical response, while Sarah focused on the most critical cases. The first patient was a man in his 40s who was struggling to breathe despite receiving oxygen through a mask. Sarah could see that his respiratory distress was severe and worsening. "His oxygen saturation is dropping," she reported to Doctor, who was working alongside her. "We need to intubate him immediately, but we also need to consider that his airways might be damaged by chemical exposure." This was exactly the kind of complex decision-making that required experience. Intubating a patient with chemical burns in their respiratory system was risky, but allowing his oxygen levels to continue dropping was even more dangerous. Sarah's knowledge of chemical exposure protocols guided her recommendations for the procedure. While Doctor prepared for the intubation, Sarah moved to the second critical patient, a young woman who appeared to be in her 20s. The woman was conscious but in severe distress, with chemical burns visible on her arms and face where her protective equipment had failed. "What's your name?" Sarah asked gently, kneeling beside the stretcher. "Maria," the woman whispered, her voice hoarse from chemical exposure. "Hi, Maria, I'm Sarah. I'm here to take care of you," Sarah said, beginning her assessment. "Can you tell me exactly what happened? What chemicals were you working with when the explosion occurred?" Getting accurate information about the specific chemicals involved was crucial for proper treatment. Maria was able to provide details about the exact substances present in her work area, which helped Sarah understand the type of exposure and potential complications to watch for. As Sarah worked with Maria, she noticed symptoms that indicated the young woman was developing pulmonary edema, fluid buildup in her lungs caused by chemical damage. This was a life-threatening condition that required immediate intervention. "Doctor," Sarah called out, "I need you here as soon as you finish with the intubation. This patient is developing pulmonary edema." The next several hours were the most intense of Sarah's career. She moved between the critical patients, constantly monitoring their conditions and adjusting treatments based on how they responded to the initial interventions. Her experience with chemical exposure cases proved invaluable as she recognized subtle changes that indicated improving or worsening conditions. The man they had intubated began to stabilize after the procedure, but Sarah noticed that his chemical burns were more extensive than initially apparent. She recommended specific treatments for chemical burn management and coordinated with the transport team to prepare him for transfer to a specialized burn center. Maria's condition was more complex. The pulmonary edema was responding to treatment, but Sarah was concerned about potential delayed reactions to the chemical exposure. Some toxic chemicals could cause organ damage that didn't manifest immediately, and continuous monitoring was essential. Her kidney function might be affected, Sarah told doctor during a brief consultation. The combination of chemicals she was exposed to can cause renal damage. We need to start protective protocols now before symptoms develop. This kind of preventive thinking was exactly what made Sarah so valuable in emergency situations. Less experienced nurses might focus only on treating current symptoms, but Sarah's knowledge allowed her to anticipate potential complications and prevent them before they became life-threatening. The third critical patient was an older man who had been closest to the explosion. He had suffered both chemical exposure and physical injuries from debris. Sarah coordinated his care with a trauma specialist who had arrived via the second helicopter, ensuring that both his chemical exposure and his physical injuries received appropriate treatment. As the evening progressed, the field hospital evolved into a well-organized treatment facility. Sarah found herself naturally taking on a coordination role, helping to prioritize patient care, manage supplies, and communicate with the various specialists who had been called in to help. Colonel Hayes approached Sarah during a brief, quiet moment. "Nurse Martinez, I've been watching your work today. Your expertise has been instrumental in saving lives here. The way you've managed these complex cases and coordinated care has been exceptional." "This is what I was trained to do," Sarah replied, checking on one of the patients who had been stable but was now showing signs of respiratory distress. "Actually, it's more than that," the colonel continued. "What you've done today goes beyond standard nursing training. The way you anticipated complications, recognized subtle changes in patient conditions, and made critical decisions under pressure. That's the kind of expertise that can't be taught quickly. It comes from years of experience and natural ability." As the night wore on, all 18 patients were eventually stabilized and prepared for transport to appropriate medical facilities. The 3 critical patients would be going to specialized treatment centers, while the others would be transferred to local hospitals for continued monitoring and care. Doctor pulled Sarah aside as they prepared to leave the field hospital. "Sarah, what you've done today has been remarkable. You've shown exactly why experience and expertise matter in healthcare. Those people are alive tonight because of your skills and knowledge." The helicopter ride back to the city gave Sarah time to reflect on the day's events. She had gone from being an unemployed nurse to being specifically requested for a critical emergency response. The irony wasn't lost on her that less than 24 hours after being told she was no longer needed, she had been deemed essential for saving lives. When they arrived back at Mary's hospital, word of Sarah's role in the emergency response had already spread. Several news crews were waiting to cover the story of the chemical plant accident, and Sarah found herself being interviewed about her experience. "How does it feel to be specifically requested for such an important emergency response?" one reporter asked. "I'm just grateful I could help," Sarah replied. "This is why I became a nurse, to take care of people when they need it most." Dr. Williams was waiting for Sarah when she finished with the news crews. His expression was serious but respectful. "Sarah, the board of directors held an emergency meeting this evening," he said. "After hearing about today's events and reconsidering our staffing decisions, we would like to offer you your position back, with a promotion to senior emergency nurse and a significant salary increase." Sarah looked at him for a long moment, thinking about everything that had happened. "Dr. Williams, I appreciate the offer, but I need some time to consider it. Today showed me that my skills and experience have value beyond what I realized. I want to make sure that whatever decision I make is the right one for both my career and for patient care." The next morning, Sarah woke up to find several job offers in her email. Word of her performance during the emergency response had spread quickly through medical networks. Hospitals from across the region were offering her positions, and she had also received inquiries from emergency response organizations and disaster relief agencies. Colonel Hayes called her personally that afternoon. "Nurse Martinez, I'd like to discuss an opportunity with our emergency response team. We're looking for experienced medical personnel to join our rapid response unit. It would involve traveling to disaster sites and emergency situations around the country, providing expert medical care when and where it's needed most." Sarah realized that her career was taking an unexpected turn. Instead of being seen as an expensive liability, she was now being recognized as a valuable expert whose skills were in high demand. 2 weeks later, Sarah made her decision. She accepted a position with the National Emergency Response Medical Team, a role that would allow her to use her expertise to help people during disasters and emergencies across the country. She would also maintain a part-time consulting position at Mary's Hospital, where her experience would be used to train other nurses in emergency and chemical exposure protocols. The day she started her new position, she received a package in the mail. Inside was a photo from Maria, the young woman she had treated at the chemical plant. Maria was smiling and healthy, holding a thank you card that read, "To Sarah, who saved my life and showed me what it means to truly care for others. Thank you for being exactly where I needed you to be." Sarah realized that being fired from her hospital job had actually opened the door to a career she never would have imagined. Her experience and expertise were now being used to help people on a much larger scale, and she was finally being valued for the unique combination of skills and knowledge she had developed over 15 years of nursing. Sometimes, Sarah thought as she prepared for her first national emergency response assignment, the worst day of your career can turn out to be the beginning of something much better. The helicopters that had arrived shouting, "We need you," had not just rescued the chemical plant workers. They had rescued her career and shown her that her expertise was truly irreplaceable. Her story had gone from being fired on her last shift to becoming an essential part of emergency response teams across the country. The patients she would help in her new role would benefit from every year of experience she had gained, every difficult case she had handled, and every skill she had developed during those 15 years at Mary's Hospital. The nurse who had been told she was too expensive to keep had proven that some things like expertise, experience, and dedication are actually priceless.